Thank you for joining us on a snowy Groundhog Day. Today was my first day of class, so of course we would have a snowstorm in this year of 2020-21. We're just waiting. I think we just have a couple more people coming from Hoosick, and then we'll start. Everyone hear me okay? Yeah, we're okay. Let's see, Emily. All right. So I'm gonna go ahead and start, and as people come on, we'll introduce folks and catch them up. So thank you for joining us this evening. My name is Erin Bell. I've met many of you, but not quite all of you. So I've actually very looking forward to this evening. I am one of the leaders of the funded study for the health study on the perfluorinated chemicals that we are hoping to launch this spring and summer in both Hoosick Falls and Newburgh. The funding for this 5-year study was granted through a proposal that we submitted about 1.5 years ago, and many of you provided a letter of support for that proposal. But the funding itself for the whole program really came about because of your activism in your communities and bringing attention to this issue. And so for that, I thank you. And what my goal is tonight is to start, after we do brief introductions, is to walk you through a little bit about what the proposed plan is for the study, and then really talk about the role of this community advisory panel. And we actually have 2 panels, one in Hoosick and one in Newburgh, and we decided to start this evening with a joint meeting with both groups because we thought it was important that we all start on the same page. So I'm going to start with the introductions. I'll do a brief intro to where my background is and what my role is, and then I'll introduce Betsy, and then I will start with the communities and then the other staff members that are here tonight, so that you can put names to faces and get to know us and our roles on this study. So as I mentioned, my name is Erin. I am a professor at the University at Albany. I am finishing my 19th year here. My areas of interest in research expertise is in environmental exposures and child health and child development, but I also have done a number of studies and worked on a number of studies related to adult health and those same environmental exposures. And it's in that role that I began working with Betsy on putting forth this proposal for this study. So with that, I'll introduce you to Betsy, and then we'll move on to the community members.
Hi, good evening. And thanks, Erin. Thanks for leading tonight's meeting. Some of you are familiar with me from the blood testing efforts in both communities. I've been at the New York State Health Department as an environmental epidemiologist for 27 years, and I've been involved in a large variety of health studies and in more recent years, biomonitoring studies. And my duties have expanded beyond my prior ones in the last 3 or 4 years. And Steve Vorand, who's also listening in tonight, is leading up the group that I used to lead that was in charge of the biomonitoring that we did in Newburgh and Hoosick. So he's very involved now too. And you might not all have met him before. And of course, I have not met all of you before, but you might be familiar with my name from the blood testing efforts. So we're really happy that you're all here tonight so that we can talk about the study.
Thank you, Betsy. So why don't we start with Newburgh? You happen to be, you're in, this looks like the Brady Bunch. You're all pretty much in that second row. Councilman Grice, am I pronounced? Grice.
Grice.
Would you like to go first, and then we'll go through?
Sure. So as mentioned, I am one of the elected officials for the city of Newburgh. So I'm a councilman at large. I'm also very involved with the Quaseg Creek Watershed Alliance, and I'm thinking a few of my colleagues from that will be here. And then I support Riverkeeper Scenic Hudson. Who am I missing? Newburgh Clean Water Project, of course. And we were on the call the other night with them. So that was a wonderful thing. And the short end of it is I care about our environment. So that's
Thank you. We're so glad. I know how busy you're all, and thank you for joining us this evening. Mr. Lawson?
Good afternoon. Good evening, everyone. I stand here, or I'm appearing before you as the co-chair of the Stewart Air National Guard RAC. Chuck Thomas was the previous co-chair, and he stepped down. I stepped in, and we are excited because we're moving forward with, after Chuck did the yeoman's work of creating operating procedures. Now we're in a position to sort of make that operating procedure come to light. And so we, as Mr. Grice mentioned, we met I think it was yesterday, with the Newburgh Clean Water Project, and we have a lot of support, a lot of energy behind what we're trying to do. But what we really are focused on now is getting the people engaged, involved, and informed about what's going on, because that's going to be the biggest sort of struggle to get us. People have power, and so we're looking forward. I'm looking forward personally to this. This study, to be able to be informed, to be able to understand strategies around getting information to people in a digestible manner, that they can understand and they can be activated and empowered. So I'm excited to join this conversation.
Thank you. And Mr. Lawson and I had an excellent conversation last week about information sharing. And so I'm very much looking forward to your input as we move through this. Jeannie, you're right below me on this screen. You'd like to go?
Hello, everyone. I'm Jeannie Polycarp. I work with Newburgh Clean Water Project. I also work for the Newburgh Ministry as a financial coach for the homeless shelter that they currently have. I know this affects a lot of people, and this is a great way to kind of amend what we need to in the community.
Thank you. Thank you for joining us this evening. And then Mr. Caldwell.
Yes, hi, Jack Caldwell. I'm representing the Quaseg Creek Watershed Alliance on the Stewart Air National Guard RAC. I retired twice, so I was a teacher and administrator in the Newburgh School District for 33 years, and then Black Rock Forest Consortium for 16 years. So the environment, education, those kinds of things have been big part of my life, and it's great working with Anthony. I've known Anthony for a good long time, and Ed, we were at a meeting last night with preparing for our RAC meeting tomorrow.
Thank you, and we're particularly happy to have you join us. We would very much like to involve the youth in both communities in this process and in this study, either through internships and volunteer opportunities. I can put my professor hat on. I work with several high school students in the area on research activities, and so we have several ideas and are looking forward to your feedback, in particular on those areas. We think it's important, not only for this study, but just in general of making sure we have engaged youth in research and science. So thank you for joining us. Is there anyone else from Newburgh that I don't see? Okay, so we'll move on to Hoosick. So Laureen, you're right in front of me.
Hi, Erin. Hi, everybody. I'm Laureen Hackett from Hoosick Falls. I am co-chair of our community working group here with EPA, DOH, and DEC for our lovely bunch of numbered super fun sites. And I've been on the National PFAS Committee for several years. I'm now on the leadership team there. And I've been advocating for Hoosick Falls since 2015. So it's been a bit.
Thank you. And thank you for joining us. And I think I saw Emily. Is Emily, are you able? Might be another Emily. Do you know if Emily's coming on, Maureen?
I haven't talked to her today. I thought she was.
I know she has little ones, and this is a tough time of evening.
Yeah.
So
I'm here. I'm just in the car.
Hi.
I'm currently driving with my 2-year-old.
Well, thank you for joining us. Emily is a particular advocate for the youngest children who have been impacted by these exposures. So we're glad to have you, Emily. And we understand if you're not able to respond right away when we ask you a question. So, but thank you. So, well, actually, before I move on, let's quickly maybe go around to staff. Maria Galuzzo, I'm going to have you introduce yourself real quick. I don't know.
Hi. So I'll be the one that you guys have been talking to through email to organize all the CAP meetings. I'm the recruitment coordinator for the New York site, and I'm really excited to work with you guys to learn from you and, just get the study going.
Thank you. You will hear from Maria. Mostly she works full-time on the study, and she will be able to coordinate any communication and any emails or respond rapidly to requests. So that is why I want to make sure you met her. And Elisa.
Hi, I'm Elisa, and I will be assisting Maria in working with you. So I'm looking forward to working with you all and learning from you, as Maria said. Thank you.
And then we have Erin Bell, is our other member from New Albany. She might be on mute.
Hi, this is Erin Bell. I work with Elisa and Maria, and I'm the administrative person on the New York site.
Great. Sana.
Hi, thanks, Erin. Good evening, everyone. My name is Sana Savadaki. I am an epidemiologist and one of the staff members from the Department of Health who's going to be assisting in working on this health study. Happy to connect with you all and look forward to working with you. Thank you.
Steve Shost. Steve's audio isn't working. So Steve, just briefly, Steve, you will hear from, and I'm hoping to do some Q&A sessions with him moving on. Steve is helps us with the exposure assessments. He's a toxicologist and is an expert in that area and is working tremendously on the issues around the exposures in the populations. And then just real quickly, we have Steve Ferrand.
Hi, I'm an environmental epidemiologist with the New York State Department of Health. I work with Sana and Betsy on this project.
Great, thank you. And Harshal.
Hello, I'm an MPA student concentrating in epidemiology at UAlbany. I'll be working with Dr. Corey and Dr. Savadati with the New York State Department of Health, the student intern.
Harshal was also one of my students in the undergrad program, so I'm particularly glad he's helping on this study. So I normally won't go through and take up so much time on introductions, but I thought it was helpful for us to meet everyone. Did I miss anybody? Okay.
I'll just quickly say that there's another person at the New York State Health Department, Maria Corey. I'm not sure if she's on the call tonight, but you'll see her name as well at some point.
Hi, Betsy. I'm here. I was just muted. Good evening, everyone. So this is Maria Correa. I'm also an environmental epidemiologist with the Department of Health. And you will be seeing my name in a lot of the forms that will be coming out to you. So we'll be looking forward to work with you and answer your questions.
Thank you, Maria. Okay. So in my, initially, one of the things I've been reflecting on, we've all had a lot of time to reflect this year, is when I started my training in environmental epidemiology, it'll actually be 30 years ago this August. Communities weren't often involved in our study designs and how we conducted studies. It was very much a hands-off approach. And to me, one of the most important advances in environmental research is this: finally people have realized that we need to include communities in what we do. And so I was very pleased when we applied for the funding for this study that it included a process to form these community advisory panels, so that we could actively work with both communities to get your advice, but also and your feedback, and to make sure we were moving forward in a way that made sense for the communities. But also there is a mechanism for us to design new studies, to look at new research initiatives. We see this as a program that we can build on. And in fact, we're working on a couple of grant proposals now to expand what we plan to do and look at in Newburgh and Hoosick Falls, based on some of the feedback we've had over the last few months. One of the challenges to me is that what was unusual with this proposal is that rather than CDC requesting money, they actually gave us a protocol and said, we need you to do this protocol and form a CAP. So rather than involving the community from step one in terms of designing a study, both of us were all in the same shoes, and that we have a protocol to work with. And so the advice we're getting from you now is on the logistical implementation of this protocol, but also on these other newer studies that we hope to plan. I understand why they did this. It's because they wanted to do a multi-site study across the country, and I'll explain why the rationale for that was in a minute. But from a scientific standpoint, that made sense to address all of the different hypotheses they want to look at. But that would, and if they had just simply asked us to give our proposals with our own ideas for protocols, that would have meant 70 different scientists proposing 7 different protocols, and it would have taken us 10 years to come to consensus. So in a lot of ways, CDC putting forth this protocol helped us to speed things along in terms of implementing this research. But to me, that also means I need your help and feedback tonight on how ideally the CAP would like to function and operate. And it was when I was talking to Mr. Lawson last week and hearing about the work that they've done with the CAP and their operational protocols, I realized that we needed to take a little step back. We have a laundry list of questions that we have for you in terms of operating and how to do the study. But before we get to that, I think we do need to resolve a little bit on how you want to operate, how you would like to communicate, how you would like to make decisions, and do we need to add any additional people to the CAP in both communities. So before we launch into that particular discussion, I'm just going to take a few minutes to give you a broad overview of what the study is about, or what we refer to as the core protocol. So it's the main study that is being funded, and it is the study we hope to start. COVID, hoping that the COVID numbers are reasonable so that we can start in late spring, early summer. So I am going to attempt, and I have staff to back me up here, to share my screen just to show you a handful of slides. Can everyone see those okay? Yeah, okay. So let me see if I can get this to work. There we go. So I'll start off right away. This is a graphic that all of the 7 sites that have been funded will be using for the main core study that we refer to by a number of nicknames, but the multi-site health study is probably the most common one that you'll see on our websites and in literature that comes to you. And we've actually adapted this for a graphic that we'll use for specifically for New York, and hopefully the next meeting we'll be able to share that with you. This grant that we received to do this study is a partnership with, as I mentioned, with myself at the University at Albany, and Betsy Lewis-Michael and her team at the New York State Department of Health. This is actually beneficial to do a large study like this takes, as you saw, a lot of people. It also requires a lot of input, not only from the community, but from other researchers. So by working together, we're able to conduct these larger long-term studies. And as I mentioned, this is funded by the Agency for Toxic Substances and Disease Registry, which is part of the Centers for Disease Control and Prevention. Again, the goal of this study is to look at the human health effects of exposure to the PFAS in the drinking water. And that's the particular focus, is to really look at the exposures resulting from drinking water. We will be asking questions about other potential sources of exposure to help us address our main hypotheses around the contaminated drinking water, but that will be our main focus. The other sites that have been funded for this study include areas around UC Irvine in California, El Paso County in Colorado, 2 communities in Massachusetts, 2 communities in Michigan, Gloucester County in New Jersey, and Montgomery and Bucks County in Pennsylvania. The advantage of having these 7 sites is that it gives us more enrolled participants in the study. And from a statistical standpoint, it gives us a greater ability to really look at different subtypes, different types of the perfluorinated chemicals, as well as different types of health endpoints and biomarkers that we will be studying. It also will still allow us to do New York specific analyses. So if Hoosick Falls and New York community residents want to know about a specific hypothesis in New York, we can do those same analyses in New York. And when numbers allow us, we can also separate out Newburgh and Hoosick Falls, provided we can still maintain confidentiality. So as long as we have enough people enrolled, we'll be able to do what we can in those communities. This study is unusual actually because we'll be enrolling both adults and children. Usually we do one or the other. And what's helpful here, and I actually think is good, is we're enrolling both adults and children in both communities. If eligible, the adults and children will be asked to attend a one-time clinic visit. So one of the areas of feedback we'll be asking of you is where we should locate these clinic visit areas, one in each community. And we'll be asking for a blood sample, a urine sample, and there will be a health questionnaire that will be completed. The children will also be asked to complete what we call cognitive, but it's neurodevelopment and behavior screenings. These are done on a laptop. I've actually used this tool before in another study of 6,000 children that we've enrolled in New York State. And for a subset of those children, they came into one of our clinics and with a study staff member completed a series of exercises on a tablet. The children, they're a little long, but the children actually like them. They're used to them if they're in a school setting. And so they will complete that. And that's to look at associations of these chemicals as they might be associated with neural development and behavior, things like ADHD. Or other learning issues that we might encounter. All of the participants will receive a report at the end of the study that lets you know what we measured from your samples, and you will all, there will also be updates in the published literature that we will provide, and we will provide ongoing updates to the community with updates on our analyses. We're already starting to think about how to interact with the community. And again, we'll look to your advice throughout this process so that we can provide periodic updates on what we're finding and how we're doing those analyses. And that's all part of our process. And again, this is to help us understand how these chemicals might be associated with human health. In the blood draws, we're looking at cholesterol, we're looking at thyroid function, we look at kidney and liver function markers. We'll look at immune system, autoimmune diseases, as well as things like high blood pressure during pregnancy. in terms of what we are interested in doing. All 7 sites that have been funded will have at least one community advisory panel. We have 2, and periodically we'll have joint meetings. We can also have individual meetings with each community. Our timeline right now, it's obviously shifted a bit because of COVID, but we hope that invitations to participate in this study could go out to the community late spring, with our data collection to begin in late summer of 2021. You will be introduced later tonight to our colleagues at the Research Triangle Institute. This is an organization that will help us with the data collection. They will be setting up the clinics and hiring the staff, and also bringing in some of their own staff to do the data collection. This is a group that helped do large studies with the World Trade Center back after 9/11, and so they're very highly experienced in this area, and so we've asked for their help in collecting the data as part of this study. Our objective is to enroll 1,000 adults total and 300 children from both communities combined. And if time tonight, I would like to walk you through 3 ideas we have, 2 that are moving forward in terms of additional studies to help us understand what might be going on in the community. One involving the newborn blood spots, which are collected from every child in New York State when they're born. We are very lucky in New York because those are stored and saved and stored in freezers at the health department. And we would like to get consent from parents and adults who have been born in both communities so that we could sample these blood spots for the perfluorinated chemicals. We also have a grant that's going in to look at the stored samples from the biomonitoring. So for the folks that supplied samples in a biomonitoring program over the last couple of years, to look at the same markers we're measuring in the multi-site study, to look at changes over time. And this will be particularly helpful for the science. And then we are actively pursuing, since we hope most of the participants that enroll in this new study will have received their COVID vaccine, we would like to measure for those antibodies to see how well that vaccine is working in terms of producing antibodies to COVID. And that is, again, an open question related to the immune system impacts that the perfluorinated chemicals might have on the body. We have all established, and you saw in communications with you before tonight, we have a text number. We have a study-specific email. So Maria Galuzzo and Elisa Grimm have access to this email, and they monitor that daily. We have a toll-free number and our website, and we have updates to the website that are actually happening this week. And I'll chat about that this evening as well. And then we have a Facebook page, and that link to the Facebook page is also available on our website. I won't dwell on this. When I present to the communities, I sometimes mention these. These are other activities going on in Newburgh, and the biomonitoring program, I just noticed my title, is also happening in Hoosick Falls. And so one of the challenges we will have in communicating with the community is to help everyone understand all the different activities that are going on. So again, we'll be reaching out to you for advice on how best to do that and to keep things simple and very clear, because we do have a lot going on. All of it is to help, but we don't want to confuse people. And so this is just something that's come up from time to time. Okay, so I'm going to stop sharing and do that. So do you have any questions on what I just said in terms of before we launch into a discussion?
Yeah, sorry. So just a quick question. That will be translated in Spanish as well, correct?
We are translating everything into Spanish and Haitian Creole for the community. So, and in fact, on our website, including this presentation, all of our presentations are translated, but so will all of our study materials. And we do have study staff that are bilingual. So we have paid staff, but also undergraduate and graduate students that are fluent in both Spanish and Haitian Creole. to help us.
Thank you. And then just one more quick thing. And then let's ensure that the language is at a level where it's accessible to most of the masses.
Yes, and that is we have talked
So,
about that, and I talked about Mr. Lawson last week, that we are very conscious of that, and that is where we'll need your community's help on that. And also, I have found it particularly helpful with my students because they will take something home and they'll let me know when something doesn't make sense. So we definitely are aware of that. But we also need help reminding, we put out something that we think makes sense and it doesn't. So we want to be respectful. And we'll definitely look to that. And this is another role that I anticipate some of the college students from the two communities and some of the high school students can also help us with this important aspect. And they can also teach us and help us guide on some of these materials. And that might be a role that they could play. Any other questions? Yes.
Has any thought been given? So one of the challenges in any kind of engagement with the community is, and I heard you say it, I just wanted to find out what your thinking is around, we're coming to help, right? But it sounds like we're doing a study. And so at the end of the day, I just want to be mindful of, want you to be mindful of that conversation, because we don't want this to come off as I'm helping, but really you're helping me to complete this study. So, so to that point, after the study is complete, then what? So you have this information, you share this information with the community. Then what is the result of that? Is there going to be, for example, you're having COVID testing, and we know that there's not a lot of COVID vaccines. So what happens when you do this testing in your study and it's revealing, which probably is the case, certain communities like Newburgh may have a plethora of people with the disease. Will vaccines be I just want us to be mindful of that. And also wanted to double down on Mr. Grice's point. It's not enough just to translate it. You know, we had this conversation, Erin, Dr. Bell, but one of the things that has to happen is there are cultural nuances that feed into this conversation as well. So just as we think about rolling it out, because we're in partnership, it's not you coming, we want to do this in a way that both gives validation and value to the community. So I just want to add those points as we consider how we roll this out.
Yeah, no, and those are key and so important. And you taught me the word, is a transcreation you talked about last week. And I fully agree. And it's a good reminder that we want to be very honest. I don't ever want to give the impression that we are something that we're not. We're doing a study. Now, in that, in terms of the study planning, at the end of the study, in addition to the reports, there are activities that we're starting to think about. Some of them will also be done at the other states. So one of them is we have talked about doing training and communication with the clinical providers so that families and participants and all community members are able to if we send them a report, what do they do with that when they take that to the clinical provider? But what are the other things that we should be doing as researchers and as study leads with that?
Can I throw one other thing in there? And Mr. Grice and Mr. Caldwell might co-sign this as well. One of the challenges that we're having with our RAC is that they won't translate anything. And so one of the things that might be cool is if you know we could work with you as a part of this process to talk about translation and providing information in digestible chunks. So I think that would be a really nice give back, you know. So what are we doing? We're doing this study, but some of the results or some of the give back beyond just the reimbursement are these types of things where we're actively engaging and trying to get information to folks to help them be informed about it. So not just the physicians, but the community, understanding what this is all about and how they can be active in advocating for themselves and clean water.
No, I like that. That would be particularly helpful. The other thing that I'm struggling with that I'll would like appreciate your advice on this meeting that I attended last week. I often hear things in my bigger world of just being an environmental epidemiologist that concern me, that I want to be able to provide information back to or resources to the community, even though my main job is this study. So again, I want to provide. So for example, last week at the meeting, there was a long discussion on lead and the importance of lead. There's a lead issue in Newburgh, and there's still some confusion on when and how often children should be tested for lead. And there are very clear guidelines for children that are 1 and 2. And this is something that I, as an environmental epidemiologist, Flint should not have happened. And people have rights. And I'm also sensitive because I remember when I was a new mother feeling intimidated by the pediatrician, and this is what I do, and I should. And so I am batting around ideas in my mind, how we can help the community with these issues in my other role as a professor at the School of Public Health. And so I need to find the right way to do that. Not that I'm not coming in on my white horse, but I think there are things that I hear at these meetings that I know there are resources that we can connect and perhaps design and reach out to. And I would like to find a way to do that, again, is meaningful and helpful. I have translations, not only just the language translations, but to translate from a scientist to just working with people in the community with that. So I as we move forward, I would like some guidance on that and your thoughts, because it's hard for me to sit back and not act on that when I hear things that I think that might be able to benefit the community with that. So I think these are, and we might have some resources that we can point you to with that. So in terms of translations, in terms of feedback, how, in terms of, and maybe this is the document you put together for the RAC would be helpful, but how do you want to operate? How do you want us to send you information? How should we approach you in terms of asking for your input? I know many of you are multiple committees and multiple meetings. Do you want a resource page? How would you like us, or do you envision us approaching you? There are times I don't want you to be caught off guard or by surprise by the questions we ask. And I know sometimes you want to be able to read through things and think through it before we bring it up at a meeting. So how would you like that to feel like?
I'm gonna pipe in, leave that question for Newburgh. We're so small here, it's just not applicable. You give it to us or our CAG group, we spread it out, right? I mean, or you come to a village board meeting. So I'm not trying to be quiet, but that's a big Newburgh question because they're 10 times the size we are.
Erin?
Yeah.
One of my thoughts, having dealt with grants over the years at school and everything, is what the group that gave you the grant money, the CDC, what is it that they're interested in? And it's also a group that the past year or so have, I don't know how good the press is on them and where the perception people have of that group. For me, the bottom line has to do with getting our drinking water back so that we don't have contamination issues with it. Another piece to this is, are there a cancer registry, the issue of how many people, how many kids have actually been sick, and can, those kinds of numbers all kind of interest me, and will things improve with the, how does your study connect to all of that?
Right. So I'll answer a little bit of that, and Betsy, you can always weigh in too. So this study was designed for the purpose of being able to look at communities that have this continued PFAS exposure in their drinking water, because there are the C8 studies that happened initially that were the focus of the Dark Waters movie with the PFOA exposure, but a lot of other communities, and Newburgh's one of these communities, have other types of perfluorinated chemicals in their drinking water, not just PFOA. And so this study was funded by CDC to look at all of those different types of perfluorinated chemicals that are currently being measured. In terms of establishing a registry, that's an interesting concept. I mean, so New York State has a birth defects registry because as a result of Love Canal, that was a deliverable when Love Canal happened back in the 70s. And that's because people were worried about birth defects. And at the time, there was no way to identify children born in the state with a birth defect. And so that's why we have a birth defects registry. The funding isn't designed to create a registry. It's more designed to look at these specific study scientific hypotheses to see what the health effects are with PFAS. Now, in the language of the funding, it was suggested that after the first 5 years, ideally, they would like to keep following the participants over time to continue to monitor for those same health endpoints to see if there are changes over time. So while it wouldn't be a full registry, which typically just enumerates health outcomes like cancer in people, but doesn't look at other exposures in a study format, this would look at the people enrolled in the study over many years. And we enroll and look at them and follow them over time. We would have to apply for more funding, but that's how we do things. CDC, and you're right, and this might be an educational moment, has many different, like all bureaucratic entities, has many different groups. They also do research, and they do research on public health questions. And because this is a contamination resulting from a large-scale contamination across the country from old industry and the use of firefighting foams, it falls under the purview of CDC. So they have funded with their research bureau and research scientists that work there this collaborative study. So they have scientists that work there full time that are interested, and they're scientists, they're interested in these hypotheses. And we will all have to sign, we all have the potential to do study analyses and publish papers and reports on these study data. But so it's a different group of people than the people who are working on the COVID and the public health emergency. They are scientists who are environmental epidemiologists, like many of us here on the call.
Yeah, I just wanted to pipe up a little bit about the study design here and what makes it, I think, especially useful for understanding PFAS potential effects on health, not 10 years down the road that we might have to wait if we were following people for 10 years to see what's going to happen. But this, and it would be great if the study can morph into that type of effort. But right now, this one is designed to look at biological effects and to understand how they're related to PFAS exposures, and to understand really well people's blood levels, not just at the moment they have the blood test, but over their lifespan, what the people involved in the study, what their exposure has been over their lifespan so far to PFOA or to PFOS, and to correlate that or associate that, to understand that in the context of cholesterol levels, thyroid hormones, kidney function tests, the sorts of biological indicators, clinical indicators that might not actually represent a disease status at all, but might represent a biological effect that is important to understand as a potential risk for a future health effect, perhaps related to obesity or diabetes or thyroid disease that hasn't yet happened. There'll be extensive questionnaires and looking at medical records to confirm the sorts of health problems people already have, but it's these clinical markers that I think can contribute really pretty quickly as the data from this study get analyzed. So just to jump back to the cancer question, this study is not a cancer study. At the health department, as you said, we do have a registry and we can look at cancer in specific populations, but most types of cancer are rare enough that it would take a much larger study than this one to study cancer. So this one is not, this particular study we're talking about tonight is not a cancer study, but we can look at cancer using our cancer registry for Newburgh. And that's something that New York State is actually engaged in now. So there'll be some results of that coming at some point.
While we're on the finance question, can I run something by you, Betsy and Erin? I've gotten like 4 emails the last 2 days from either 2 of the other multi-site studies and from 2 congressmen about the 2020 NDAA and the 15 billion or 15 million or whatever that was. And they're concerned that the CDC isn't going to use that full 15 for Part B. Is that a concern we have right now before I answer these people?
So I responded, I got the same email.
Okay.
And so what happened when we put in the proposal, we had to explain how we were going to do and commit to doing the core protocol. And then we had proposed 2 analyses. One was to, as I mentioned, the stored biomonitoring blood spots, because that would help us look at these same markers over time to see if there's changes in the few years since the initial biomonitoring samples were taken versus what we're measuring now. And that's important for understanding the risk for disease. And then the other study was this newborn blood spot study. Our funding was, they awarded us, and they said you're awarded, you're approved, but then we all had to cut our budgets for definitely the first 2 years, and it sounds like the next 3 years. And the funding to do these extra studies is not guaranteed, but they've also cut a little bit into the core protocol. And so the short answer to the question is yes, the budget has been cut. We were still very much we had made adjustments so that we could get the core protocol done. And then we were actively and we're pursuing other grant opportunities in case we can't get the funding for these other special studies. And that's in essence what I told the legislature aide today, is that our initial promise of the funding was cut, and that we have made adjustments so that we can do the core protocol, but we don't have guaranteed funding for these sub projects that we feel are important for the community to fully understand what's going on.
Okay, well, we have a call, the coalition has a call with Dr. Bricey tomorrow evening, so I will beg and plead to fully fund the entire thing. Okay, that was it on that.
So I have an idea. It sounds like we might ultimately get to a point where we have a couple of work groups, perhaps a group that could help with translations, another group that might help us with how we could not just communicating the fact that this is a study and we're not, and that's our main role, but that we have other components coming from this, working with the youth to help with the study, but also what are we doing after the study is done? What are the next steps? What are we providing for the community in terms of making sure they understand what we have identified in the study, how to communicate with clinicians, and what the next steps are. Would it be feasible to, if perhaps, I don't know, once a week, maybe once every other week, send an email with a summary of what's going on and a list of the questions that we're going to have for the next meeting in terms of feedback, with whatever information we need to share with you, so you have that information so you have time to digest it before a meeting. Is that reasonable? I don't want to plug up your emails, but I'm trying to find the best way to communicate.
I would agree to that. I know for me, my schedule is a little busy. And so if I have that email ahead of time, you know, I can peruse it and get a better understanding of what we're going to be talking about. I think that'd be helpful. And then especially if there are terms or other things in there that I'm just not familiar with, like if there's a link to, if I want to dig in a little deeper, that would just be very helpful for me.
All right, that's good. Yes, Mr.
So
Lawson.
yeah, just to add to that point, that I wouldn't mind it as well. The way the RAC operates is they send us the agenda 2 weeks before our scheduled meeting. So just in that bi-monthly or bi-weekly thing, I never know how to say that. Whatever that is, let's try to make it before, a couple of weeks before the meeting. That way people can digest it and be really give real input at the meeting.
Okay. And I was actually just about to ask if 2 weeks prior to a meeting made sense to you, it would give you enough time. So it sounds like we can try that.
Can I throw something in about the finance too?
Yeah.
It would be interesting too if there's a grants committee, if we identify funding that could be used then to help with some of the things that we might want to do in the community. As we're doing a study, we find out some things, but hey, there's some funding that either can do more studies or bring some relief to the community based on the studies that we have, because we now have that information. That would be really, again, we're trying to make this as palatable for the community and as engaging for the community as possible. So anything like that makes a lot of sense. It shows that we're working with and for the community and not just coming to, that's the challenge with studies sometimes.
It is, and this was kind of created after the fact. Normally we would start with a cap and work our way to a grant and a study. And so I like that idea a lot. So I'm hearing maybe 3 groups here: the translation group, a grants group, and then perhaps an initial group for advice on the study mechanisms, for lack of a better word, how we might, like, for example, one of the questions upcoming is, where do we identify the clinic sites? RTI has a group that has identified several options, but we would like to give that information to you and get your feedback and say, no, that's an awful place, no one will go there, and that kind of thing. And so we won't have time to delve into that tonight, but that would be a piece of information we would discuss at the next meeting.
Yeah, I like that idea. I was going to just spitball this with Mr. Grice, but what I've seen happen in community schools is that you actually go to the school is equipped to serve as a clinic and provides additional and other services. So it might be a really interesting thing to do. For example, one of the schools I worked with, they actually had a dental office set up so that kids who never had, dental visited a dentist was able to visit a dentist in the actual school building, and they extended it to their parents and family. So I just want us to think sort of outside of the box, maybe. We do have community schools in the heart of, there's a community school in the heart of the city of Newburgh. So that might be something that we consider, because I don't know the demographic access to the community qualified health center that we have. I haven't, so I just wanted to throw that out there.
And I'm familiar with the health centers because DOH is involved with those, and so we can definitely reach out. I don't know if Suzanne's familiar with this, but in New York, a number of our cities in particular, and some of our rural communities have health centers inside the schools, because it is a way to facilitate care and preventive care in particular to both the children and the parents. And so I wasn't sure if Newburgh, so that's a great idea, and we can explore that as another option.
One other just logistical kind of a thing is the way the Newburgh City School District is set up. So it actually serves 3 communities. So the town of New Windsor and the town of Newburgh and the city of Newburgh are all part of the school system. And so the kids can cross these boundaries in whatever school they are assigned to go to. So you'll see kids all over these 3 communities. but maybe, reside in the city of Newburgh, but attend school elsewhere. So, or the other way around. So it's one of those things to pay attention where the kids are going to school and where the kids are living.
Okay. Yeah, no, I think that's all. And that's exactly why we need your assistance, because you understand the communities and can help us with that as we go forward. That'll be an issue because, believe it or not, if it is a situation where we need to sign leases or get approvals, and I think our next meeting, that might be a key topic that we'll need to cover. In terms of how frequently you could meet, I envision early on we might need to meet a little bit more frequently as we get things rolling and get to know each other, and then work groups would also be able to kind of peel off and do their work. But would it be all right with you if we schedule one for a month from now to go over these, but we'll communicate via email with some key feedback questions? Is that good?
Yeah.
Okay. So
Yeah.
we'll plan on a month with at least 3 work groups. I think another area that the grants work group could help us on are how to handle letters of support requests for as we write grants and things like that. So there's some, I do like this idea of the 3 work groups. There's one thing I do want to show you before tonight, and we'll put longer narrative in the email. I'm going to try and share my screen again. If I can find it. Hang on one second. Did I not? Oh, hang on. One of the one of the requests that we had from the communities early on was to help with all of the literature that's coming out, is to have a way that's digestible and updated on the website. And Maria, I may need to, I guess, Maria, can I have you load it up? Oh, here we go. I found it. Hang on. And so we've been working with staff in-house on how to do this, because there's obviously a lot of peer-reviewed published literature related to the epidemiology, and people are interested in this, but it's also obviously very technical. And so we had a small work group with a couple of members from both Newburgh and Hoosick Falls help us. And we originally had this very large spreadsheet, and Lorene Hackett was very helpful because she couldn't read it and all the rules now with websites is they have to be viewable on a website, but also viewable on a phone. And so we met with our web designers at the University at Albany this week, and they were actually very helpful. And this is a mock-up. This hasn't gone live yet. And let's see if I can back out of it a little bit. That we will host on our study website a page where they can, community members can go to a specific health endpoint that they're interested in, and any paper that's been published on this topic will be here with a very short description of purpose and the study conclusion. And we have to work a little bit on easing this language a little bit, and there's a hyperlink to every article. And then we have our study emails so that people can email us questions that we can respond to immediately. And then I'm obviously happy to do the Q&As as I've been doing to address this. So these are all the articles related to reproductive, and here we go. The other health endpoints that we'll be looking at in the study are also listed, and under each one will go the rest of the articles, and we'll update this every month. We decided to just simply go with study purpose and study conclusion, just so people understood what the purpose of the study was and what they found, and then they can look at the article themselves, and if there are additional questions, we can provide that. We will translate this. I have my students helping me with this with both Spanish and Haitian Creole, and when we get further along in that process, we'll share it with you again in that translation committee to perhaps help us a little bit in how to make things accessible to that. So because we do have as a goal for everything on our website to have have it be trilingual for everybody with that. So this is something we're working on. Yes.
I think also because this is federal funding, you'd have to be 508 compliant as well. So I'm assuming that you would be. When I
Right.
work, yeah.
Yeah, and that's what we're working at. And that's, I pulled in our website, I don't know what their official title is, at the university to help us with that process, to make sure that we are compliant with those. And that's correct. We do have to be. So they're helping us make those adjustments and helping us with formatting. And so I think in the email follow-up to you, this is a mock-up that we'll send to you in a link so you can spend more time with it. And, you know, we would welcome any feedback and ways to improve it for people who might be interested. Okay. One last question, because I know we're right at 6 o'clock. We had for communication, in terms of do we have your permission, and if you're not comfortable responding in this forum, we can send it an email. Are you okay if we share your contact information with other members of the CAP? So that if you need to contact one another, you can. And if so, what your preferred contact information is. So we can send that request to you in an email with the information we have on file. And just to have your you know, just to make sure we've you know, are being appropriate, that we can share that. And the other question we'll have, and again, we can put this in an email summary, is maybe list your names on the website so the communities know who's on the community advisory panel for the two communities. So we'll send a spreadsheet with that information, and just again to verify your permission to share your names. And the contact information within the group. If communities have questions, and this is another logistics decision you can help us make at the next meeting. If communities have questions, how do you want them to contact you? They can contact through us, or is there a number you want to use for the CAP? And how do you want to set that up in case they want to reach out to you?
So when do you need that answer by? And the reason why I'm asking is because I'm an elected official. So the email that you were using is my city email. But as you know, all of those are foilable. So that can get, sometimes people are asking questions that, and you know, we redact things or whatever, but sometimes people are asking things and it really has personal or sensitive information in it.
So we don't need this immediately. We can. Okay. I envision that we're going to send you a longish email with what we talked about tonight, and a few immediate things. This is being one of them, and then the date and time for the next meeting. So if you need time, I fully understand that issue, and whatever we need to do and how best. Now, that email will most likely, if that's the email we have on file, this initial email will go to that, right, and you can let us know what to adjust.
No problem. No problem.
All right. For the meeting a month from now, is this day and time good? Do you want to change it? Do I do a doodle? How does this work? I know we tried it. Okay. I'm anticipating we might need to do 5 to 6:30. Just at least initially for the first next couple of months, as we work through some things. If we end earlier, great. We can be really tight. And again, by having work groups, that might help us actually speed things along. But if it's all right with you, I'll book it for 5 to 6:30, just in case, so that your calendar is straight.
So are you saying we're definitely going to do it on Tuesdays? Because I teach on Tuesdays. Okay. So
we can change.
Do you want to do the doodle to take in every? Yeah.
We can do a doodle. Our evenings definite. And that's my assumption that evenings have always been better. But so we can send a doodle for a month from now with a slate of options for days and times, and then go from there. I know many of you are on these multiple community meetings that we need to balance. Okay, so we'll do that. I'm just double checking the agenda to make sure there's not anything else that we absolutely need to cover tonight. Is there anything else from anyone that we need to, that you'd like to bring up, or a question?
I'd just like to say that chart looks much better. I like that. That was great.
I'm glad you, I was getting worried, and then it dawned on me, we actually have experts that I could ask rather than us trying to figure it out. So, and they were great. The Albany folks were great. They responded right away and they knew what to do. So we're gonna work with them. And similarly, related to that, the in the same office are the media and marketing people who can also help us with any, as we get closer, and if any publications we want to do. So that'll be another discussion as we get into the study.
So do you want to still keep adding and adding and adding and adding? It seems like these studies are starting to come out a little fast and furious. So
we may need to maybe make a cut. Right now it goes back 15 years. So we might need to change it to, you know, some of the more recent ones. And if people want more, they can ask us and we can send it to them. So we can look to see how messy it's getting. We also, for those who get on our website, we are in the process, again, with the same people at UAlbany. I asked them this week to help give us some ideas how to make it a little less busy. We have a lot of information on there, and I want to make it clear and put the study front and center, because again, to be honest with everyone, that's our main goal. But then we have and do post, and I think this is important, other information related to perfluorinated chemicals that they might be interested in. And so they're moving forward with that. But our intent is to update with new studies every month, because the stuff coming out now is actually pretty important.
it is, yeah.
And so that might mean maybe some of the oldest stuff we obviously have it, and we can always provide that. If people want more, they can simply email us and we can provide that. And so we may end up doing that just to keep it simple.
Okay.
All right. Anything else? All right. If you think of anything, you're welcome to email us at the pfas@albany.edu and we'll respond. In the meantime, we'll put together a summary of this evening's talk. We will also be posting this on the website. We'll send a doodle to schedule the next meeting, and then 2 weeks prior to that meeting, we'll send you a little list of things that are coming up that we might that we'll want to discuss and talk about. Good. All right. Well, thank you very much. Stay warm, and I hope you don't have to shovel tonight. We're all looking forward to summer.
On a side note, Erin, congrats on the NIS panel.
Thank you. I meant to let people know we have our first meeting on Thursday. There is a National Academy of Science committee that's been established to look at and review all of the literature related to perfluorinated chemicals and to provide guidance for communities on testing and guidelines for perfluorinated chemicals with what clinicians should be looking out for. And we have the first public meeting on Thursday, and I think the agenda, our full meeting is quite long, but there's a public session in the afternoon, and 20 community members from across the country will be testifying. The link to that study is also on our website, and I'll be periodically, obviously, as we're deliberating, I can't share what we're deliberating, but I can let you know when there are public meetings, and there will be updates on the National Academy site.
Right, from 1 to 5 on Thursday, I believe you can listen in.
Right.
And to save you both, I did not sign up to speak, by the way. You hear me enough, but you will be hearing from my cohort. So
that'll be really interesting.
I was so glad to see you were on it. Really, I mean, we got approached to and asked for recommendations months back when they were forming it. So when I saw your name, I was like, oh yes, I was very, very happy to see that you got selected and took it.
Thank you very much. I'm looking forward to this. We have 18 months to do this report, and a number of us on the committee are pushing very hard to make sure that we hear a lot from the communities, and especially communities that are typically underrepresented for these types of activities. And so I'm looking forward to it. It is a good group. And so this will be the first meeting. So I'm looking forward to that. And we'll definitely, and we have it on our Facebook page. We posted the opportunity so people can register to listen in if they want, and that information will be provided to them. So thank you. Yeah, and I thank you for reminding me. I meant to mention that tonight. So I will
Congrats anyway. Like I said, I think I can say, coming from Hoosick Falls, I feel comfortable in knowing that you will bring a community. You've been around us for so long now that you will bring that community perspective, from some of the other folks that got selected that I don't know. So it's very comfortable in the fact that I think you will have, you'll always have us in your head. So for better or worse.
Way, and this is a really important, I've been on these committees before. They're very important, and I'm thrilled that we can play a role in it. And so I'll keep you apprised of that. And so thank you for reminding me. And this is another key deliverable that will come at the end of before the end of the study, actually, for the community. So I think that'll be helpful as well. Hopefully that'll be helpful. So, all right. Well, I will let you all go. Thank you again. Feel free to email us with any questions, and we'll follow up with a couple of emails to schedule the next meeting, and then a more detailed email with materials for the next meeting as well. All right. Thank you very much.
Good night, everyone.
Good night, everyone.
Night, everyone.